Good afternoon and welcome to APHSA Third Thursday 360. We have a few housekeeping items before we get started. We ask that you take time today to rate our sessions. Check out the community to connect with your peers, and during the break, stop by the exhibits area. Visiting our sponsors not only gives you an opportunity to learn about solutions, but you are also entered into a drawing for a gift card from APHSA. It is now time for our next presentation. The impact of mobility on worker retention, client outcome, and quality data. This session is underwritten by RedmaneTechnology. It is my pleasure to introduce and welcome the General Manager for RedmaneTechnology, Cheryl Hartshorn, as she leads a discussion on the impact of mobility on worker retention, client outcome, and data with a diverse group of subject matter experts. The bios of our presenters can be found at www.aphsa3rd-thursday.com. It is now my pleasure to welcome Cheryl and our presenters to the screen.
Got hundreds of, yeah, that's fine.
Great, thank you very much. Thank you to everyone for joining us this afternoon. It's really an exciting time for us to have a conversation about mobility, the impact of mobility on caseworkers and the work that they do, on the children and families that they serve, and of course, really looking at data outcome and how do we retain staff in the long run. My name is Cheryl Hartshorn, and I'm the General Manager responsible for our child welfare practice at RedmaneTechnology. It's my pleasure to work at Redmane, and I've been there for a number of years, but in a previous life, I was a frontline social worker, child welfare worker, and then was a supervisor and a manager and an executive in Canada. And so really happy to be here today to meet with some of our colleagues and social workers across North America, as well as the Quality Assurance Center for Workforce Development. So with that, I would like to talk about a few housekeeping things. As we go along, if people have any chat or any questions that they'd like to ask, please put those in the chat and we will get to them towards the end of our discussion today. And with that, I'm going to introduce some of our colleagues that are going to be sharing some information with us today. And so from the Quality Improvement Center for Workforce Development, we have Anita Barbie, as well as Dana Hollenshed. So thank you very much for joining us today, ladies. For the province of Alberta, we have Luke Penner. Luke is a permanency worker in Grand Prairie, Alberta, and you can read in his bio a little bit more about what drew him to social work, but we're really thrilled to have him join us today. And Brett Head, and Brett is a protection worker and does investigations in Brooks, Alberta, and so really happy to have her join us today as well. And then from the Commonwealth of Virginia, we have a few folks joining us. So Carlos Reyes. Carlos is a family specialist for prevention and preservation. He's from Loudoun County, and will share some of his experiences with us today as well. Brian Tatter is a family services specialist in protective services from Fairfax County. Megan Mitchell is also joining us today. She's a family services specialist in family preservation from Henry Martinsville Department of Social Services. And then last but not least, Travis Patera, and he is a former family specialist lead from Chesterfield County, and he's recently just moved to the department to help them with some of their work as well. So thank you very much for joining us today. I'm really thrilled to have this wonderful panel share some of their experiences, real world experiences with us today. With that though, I'm going to turn it over to Brett to talk to us a little bit about Alberta and what her experiences are and why Alberta chose to go with mobility. So Brett.
Absolutely. Hello, good morning, everybody. My name is Brett. Hopefully you can all see me. Cheryl, I still see that you're on the screen. Can you just give me a thumbs up and let me know you can see me? Yeah, okay, perfect. Awesome. So yeah, I'm Brett Head. I'm from Brooks, Alberta. That is located in Canada for some of you that do not know. And just to give you a little information about Alberta, we have about 4 million people in our province, which is actually quite a fair number for the size of us. And within that, we have about 2,200 caseworkers that work for us. So I'm going to speak today about the mobility tool that we use here in Alberta. We call ours Case Connect. I know Virginia calls theirs something different. So this is a tool that, of course, allows frontline staff the flexibility and convenience to enter contact notes when we're outside of the office, which of course is essential for our work. Case Connect was implemented in Alberta in February 2019. It took about a year for the child intervention business team to implement it. And once it was ready, we did a phased in rollout approach within the different regions. So this began, it came on board every 2 weeks over February, March, and April in 2019. So a new area and a new region came on every couple of weeks. Prior to the rollout, frontline staff in each region brought on management and supervisors as they were tasked with completing the training so that they could use Case Connect, as they identified this would be key to better success when it came to staff then using the tool if they knew themselves how to use it. Having the knowledge to support others was also going to be an important key factor for that. So prior to everybody else getting it within their regions, emails were sent giving everybody a heads up. We know that we like to be prepared for things. So the more information we had beforehand was going to help us be prepared to use the tool. So this included e-learnings, which were mandatory for the training. These e-learnings included support, they answered questions, talked about how to download the app on different devices, and just prepared all of our staff in Alberta to be able to use the tool. Our office in particular was one of the first ones who did it in the South region. And so I know for us as a unit, we did it all together. We knew that if we went through the trainings and the processes and figured out how to use the apps, we'd be more likely to do that as a group, and then we could also support each other. Lastly, I'd just like to share just a couple of facts about it. So in August 2019, shortly after we had implemented it all across the province, there were 11,141 contact logs that had been created using Case Connect. That number then grew to 73,398 by August of 2020. So keep in mind that was during COVID. And then of course, today there are about 96,707 contact logs that have been created. So thank you so much for allowing me the opportunity to speak and share with you today.
Thanks, Brett. And we'll hear more from Brett and her experiences as we get into more of the discussion. I'm going to turn it over to Travis from the Commonwealth of Virginia to share with us a little bit about their experience implementing mobility.
Thanks, Cheryl. In 2016, Virginia was looking to develop an entirely new child welfare case management system. But during this process, we met with nearly 300 frontline staff and supervisors who pretty much expressed an overwhelming desire that they wanted to be able to perform their job in the field. They wanted to improve efficiency while working with families and children and capture real-time information without having to go back to their office. So based on this feedback, we decided to develop a mobile component to the current system that we're using. We used the theory of change to help guide our implementation of Compass Mobile, and we used human-centered design principles in developing it. We wanted to make sure that the workers got what they felt they needed in an effort to help improve retention. So in doing that, we and Redmane, our vendor, met with all levels of staff from agencies that are participating in the Quick WD study to learn what they wanted to include in the system. We also sent out rapid response surveys to ask frontline workers, like, how do you want this feature to work? And that way we could have their direct feedback while building it. An example of that was with our case contact notes. We sent out the survey and said, how long do you want them to stay on a mobile application? And they said 90 days. So the design requirement, we put 90 days. And then we also had a group of local testers that helped us test the usability. And also they were able to help influence some of the design decisions, such as like the colors we use, which icons are in the app. And also some of the flow, like originally we had all the different things at the bottom of the screen that you could click on, and then we switched it to having a tray that could come up, and that was based on their feedback. And I was one of those local testers and can tell you that was an amazing feeling to like give that feedback, come back for the next session, and the whole app being based on the feedback we gave. And then in October of 2019, we started rolling the Compass app out across Virginia, and we have 120 local agencies that are run themselves individually And so we went agency by agency to do that and provided over 2,100 state issued iPads to frontline workers to be able to use the Compass mobile application. Since rollout, there's been a multitude of features and enhancements added, hoping to increase engagement and documentation accuracy. And those include things such as structured decision-making tools, an audio recording app, and the ability to do genograms. And back to you, Cheryl.
Thanks very much, Travis. I'm now going to ask Anita Barbie from the Quality Improvement Center for Workforce Development to share with us a little bit of information about the structure of the study and some of the outcomes. Anita?
Great. Thank you so much, Cheryl. We're excited to be here. The Quality Improvement Center for Workforce Development, making sure that this is slideshow, okay, is a cooperative agreement funded by the Children's Bureau. Our lead agency is the Center on Children, Families, and the Law from the University of Nebraska at Lincoln. We also have a number of partners in this consortium doing the work, from the University of Colorado, Denver, the Kemp Center for Prevention and Treatment of Child Abuse and Neglect, where Dana Hollenshed is from, that you'll hear from later. I'm from the University of Louisville, the Kent School of Social Work in Kentucky. We have a team at the University of Tennessee, Knoxville, that helps us with organizational culture and climate assessments. We have the Luskin School of Social Welfare at UCLA, and several great consultants who are working on this team. And the charge of the Quality Improvement Center for Workforce Development is to understand more about the child welfare turnover problem. We have many more times turnover, almost 6 times more than the average workforce in terms of the numbers that leave in any given year. These numbers range from a little less than 20% to as high as 60% in different jurisdictions around the United States. So it's a real problem. It affects not only the agency in losing talent and investment, but it also affects families because they've lost that connection and it slows down the casework. So in order to do that, we went through a rigorous process of choosing 8 sites to work with us, where we would do needs assessment and then install and implement and evaluate 8 different interventions based on the needs of that particular jurisdiction. So you can see on this map that we have most of our work. We've started in 2016. We're in our 5th year. We're probably going to go into a no-cost extension next year to continue doing our analyses and reporting out and disseminating our learnings. But we've got, and so most are in their final stage of implementation. But in Nebraska, they worked on work-related traumatic stress and how to reduce that so as to improve, resilience and feeling good about the job and staying. In Ohio, we also looked at that issue, but we added a supportive supervision component. In Virginia, as you're hearing today, it was case-supported technology intervention, which also included transcription. So there were 2 pieces of technology that were introduced in Virginia. In Washington, they were testing telework before COVID hit, and then, of course, the whole state began doing telework, as well as did the nation. So we've been doing a lot of learning there. In Milwaukee, we looked at organizational change process because their whole organizational culture and climate needed a readjustment. In Louisiana, we're doing some innovation of really changing the job and who does what on a team and kind of redesigning the job and the team structure and what people do to make a more interdependent team to do the work. In the Eastern Band of Cherokee Indians in North Carolina, a tribal nation, we were doing an onboarding program that helps those from outside the tribal nation understand more about the history of the tribe and trauma in particular, so that they can acclimate and understand the people they'll be serving. And then finally in Oklahoma, we're in the middle of implementing a competency-based personnel selection to try to have a better fit between new workers and the agency in which they're joining to do child welfare. And we're looking to see if that not only affects retention, but also outcomes of performance. Now, we have a huge evaluation. Each site is being evaluated in a very specific way, but we have shared measures across all of our sites where we're looking at aspects of the person and understanding their personality and their attitudes and their views of the organization in terms of supervision, supervisory support, coworker support, what kinds of stressors they're experiencing, how they're able to manage the work, whether they intend to stay or leave, their satisfaction, as well as, again, that larger culture, and then looking across all of our sites to see how do those interact with the different interventions we're trying, like which of these works best for whom in terms of an intervention. And then they're telling us about not only do I intend to stay or leave, but we're looking at actual retention or turnover. We're looking at casework practice as well as ultimately the outcomes for children families. In Virginia in particular, because they were already kind of set on a path, we took the opportunity to partner with them to study this process of rolling out technology to support the workforce. And so of the 120 localities, 18 stepped up to be part of the study and the special implementation pieces for the project. And you see that there are 5 regions across the state of Virginia, and that there are, of those 18, they're sprinkled throughout all the regions. So we have representation of the workforce from Appalachia. You see in the purple area, very small areas, often small offices and very high need people that they're serving. You see the central part of the state. You've got lots of variety of Roanoke City, which is a little larger, all the way to Body Top, which is smaller. Then you've got the coastal area, Williamsburg and York and Norfolk, and that region of the state. They all have their own kind of culture and needs. There's some in the kind of the middle area, Henrico and Chesterfield near Richmond, and then those in Northern Virginia outside of the Washington, D.C. area. And some are very large, like Fairfax and Arlington. So we tested everywhere. We were using a time series design as we look at these different interventions as they roll out and different new pieces of mobility as it rolls out. And again, we had the 18 counties. We're looking at the workforce. It's about 400 or 500 people that we're studying over time and looking at how they're uptaking the information, how they're responding to the new technology. Why does it happen for a few months after with these little diary studies? And then we have large surveys that we're given at baseline and every year or so to see overall how are these new innovations helping the workforce to cope better with the work, be more efficient, and want to stay. And we're going to stop now, and then later Dr. Hollenshed will share more of the results.
Thanks so much, Anita. That's really helpful to set some context for the study. That's wonderful. Good. And with that, we're going to turn to our panel and talk a little bit more about their experiences and hear a little bit more. So I'm going to start off by, and my job is just to ask the questions. These practitioners have all of their really great answers and from their experience. So let's start off by asking, what was your overall impression of using mobility? And just to get us started, I'm going to ask Carlos to jump in and start.
Hey, Cheryl. Oh my gosh. Well, thank you so much for having me. It's such a delight to be here with all the panelists and to get to share our experience from the field, really, because we got so excited. When I first heard about, mobility and technology, I was one of those first adapters, the pace setter, if you will. And I just took, the technology, the iPad that they provided me, and then to be able to do amazing work with our families. So, the overall impression is, I think it's a game changer. I think, technology is here to stay. I think technology is actually going to improve and get better. And now I think that it's actually going to be a critical component in service delivery on a post-pandemic world. So I'm super excited about all the utilities that come with it and all the possibilities. So I'm super excited.
Thanks, Carlos. Luke, do you have a perspective on this?
Yeah, for sure. Thanks, Cheryl. And thank you, Carlos. I agree with you completely. And just want to add to that, I guess, that it's really changed the way that I do work in my office. So I started with Alberta Children's Services with my practicum actually in the assessment field. And back then they were just using paper and they'd write contact notes on their paper. They'd come back, and me being the practicum student, I'd be the one typing it up on the computer to put it into our system. And so really there was double the work at that point. So bringing in a concept like this where we can just bring out a cell phone with us and right there and then we're just typing on it, and it's immediately uploaded, takes away the paper. For starters, we're saving trees. For second, we're saving work, which is time and money, and we're able to give that back to our clients that we're working with. So it's really impacted them as well. And I know previously Carlos had mentioned that our clients are just so used to having technology in their homes that it hasn't changed anything for them. Like, if anything, they're more comfortable with us bringing in a cell phone, a laptop, or an iPad than they are with us bringing in like our little ticky box and trying to write down on paper. They're extremely comfortable with it. So again, thank you for letting me be a part of this and share, Cheryl.
Thanks so much, Luke. We appreciate your perspective. Brian, is there anything that you would add to this?
Yes, I'm Brian Tyler. I'm a CPS investigator in Fairfax County, and whoever knows Fairfax County, it's a major metropolitan area outside of DC, and we get a lot of cases and have contacts with a lot of families, and mobility has totally changed that. I used to rush out of houses and try to get back to my office to type up all the notes that I just did for my 2-hour interview, and mobility has totally changed me. And the ability to stay with the family longer and do a more thorough investigation while I'm out there in the field and have the notes automatically uploaded into the case documentation system. And it's just been, like Carlos said, a total game changer. And I have only had such a positive experience.
Great. Thanks, Brian. Brett, what was the impact in you as a worker, as a caseworker, in using mobility?
Yeah, hi, thanks, Cheryl. I'd like to piggyback on some of the things that my colleagues have already said. What a game changer. Who would have thought having the ability to use mobility in the field would be a need that we didn't recognize prior to that, right? And so for me, I think the biggest impact it had on me as a worker is what a time saver. We work in a job where there isn't enough hours and enough days to do the work that needs to be done. And so having the ability to do that work in real time with our families made the biggest difference, I think, in the work that we do. I think also being able to make sure that we have our notes there on time in the event I wasn't present or in my absence. Everything that we were already working on was there. So somebody else would seamlessly be able to pick that up and take off from where we left off. So absolutely made a big difference in the work that we do with the families, how efficient we are with our documentation, and then the work we're able to provide to our families. Thanks, Cheryl.
Great. So all of you guys are great cheerleaders and for mobility, which is wonderful. And I'm sure Megan is as well. But I'm going to ask Megan a little bit of a different question. Megan, what were some of the challenges? Maybe not for you, but maybe your colleagues.
So when Compass was first introduced, I did have some colleagues that were not as excited as I was about using technology. Some people that had been in the career a little bit longer than I had, because I started back in 2016, right out of college. And some of the workers that had been in the field longer than me were just not as excited for another change. They were used to paper, going out, writing notes, handwritten, coming back and typing it up when they had time, and kind of felt like technology would be a little bit rude to have in front of the families. So that was a challenge. I did, like everyone else has said so far, I was super excited to have technology because it allows me to focus on certain things being in the home. So I tried to encourage my coworkers to be as well, the best that I could.
Great, thank you. Travis, I'm going to ask you a question. I know the Commonwealth of Virginia did some work in helping caseworkers like the folks that Megan has talked about, maybe get used to using technology in the field and how it kind of shifted their practice a little bit. You want to tell us a little bit about that?
Yeah, so we offer every Friday, we offer what we call a lifeline that people can call into. And we usually do like a demo of one feature, but then leave the rest of the call for people to be able to ask questions, ask us to show them how to do things, or if they have a problem with something, just to try and be able to do that. Prior to implementation, we would go to agencies and show staff the iPad as it was still being developed to show what features we had and get feedback. And it worked two ways for that. One, to get their feedback to see if we needed to make adjustments, but also to try and amp up excitement in the staff. And then there was an agency that made comic strips showing like, oh, you're removing this kid, you have to get all these forms filled out. Oh, it's on your iPad. And like, so the different little blips in it showed them like how the iPad would make different aspects of the work easier for them to do.
Great, great. I know in Alberta, both Brett and Luke have been working with their colleagues about adoption. And so any other tools that you guys have used in terms of getting people to use the mobile device?
Yeah, I can add in on that. So I love technology, so I just took Case Connect when it was available and ran with it. Like people have said, not everybody, especially our colleagues with more experience and used to using paper for 20 years, they're a little, well, they're having difficulties transforming to this new platform. So I've offered many of my coworkers to help them out, download the app for them, because sometimes that's the most difficult part, is just getting it on their device. And I've actually done several meetings with colleagues where my other supervisors have asked me to join their unit meetings and actually give a bit of a presentation and just, tips and tricks on how can we really make the most of this technology that we've been given. Because all it is tips and tricks that we need to know. And once they figure it out, they're off and flying. So.
Great. Thanks very much, Luke. Brett, how about from your perspective?
Yeah, absolutely. Same as Luke mentioned, I think it's more just about being user friendly. I think when we don't know how to do something, we can be apprehensive about it. And when we're used to doing something else, that's our go-to, right? So I think in our office, it was a matter of supporting our colleagues, and in other offices as well locally, just how to use it, even if it's as simple as sitting down, helping them enter their first notes so that they can see it is really, really easy to use and very functional, and then them taking that into their practice. I know a lot of people have used things like iPads and iPhones. I have not used that. I strictly use my laptop, so I could benefit from broadening my practice even a little bit more. But yeah, absolutely, just helping colleagues, whether it's entering notes or what they do or how they do it or downloading, has been something we've done around here as well.
Great, thank you, Brett. We're going to talk a little bit more about the impact on clients after we hear more from the QICWD folks. But one of the things when we were first testing MCASE mobility, the mobility component of that of the application, I was really curious because I was an old school social worker that used to write my contact notes on Friday, and I had a better memory than I do now. But I was wondering, how would clients be impacted by this? And so I'm really interested to hear what you folks have said or will say about this. But I know that the folks that we did a little bit of beta testing with, they'd said, well, clients expect, just like you've said, that we're keeping information about them. And so they want to be part of that process. And so really from a transformative way of doing social work, aside from, how do we get the actual tool to work for us? And then how do we practice? That changes a little bit for sure. So with that, I'm going to turn it over to Dana Hollenshed to talk a little bit about more about what their findings were from the QICWD study. Dana?
Thank you. Let me do my share screen, pull it up. You guys all see it? So I'm, again, Dana Hollenshed with the Kemp Center, and I'm thrilled to be part of the research that's going on in Virginia, looking at the impact of mobility on turnover. And what we're going to talk about today is really the results of a diary study that we did in order to understand how well the staff were implementing or uptaking the intervention of having a mobile device in order for us to really be able to understand what outcomes we may or may not see when it comes down to looking at turnover down the line. So we have been using a host of research methods. You'll see a long list here: surveys, using administrative data, data about case contact and documentation data. We're excited about pairing human resources and the child welfare data. And we're looking at context as well when we're looking across all the sites that we're doing work with in the project. So we're also looking at census data and policy and practice data. But today's presentation is really just focusing on this small portion, the diary study that we did post rollout of the mobility. So as Anita described earlier, when the mobility was rolled out, we waited a couple of weeks for folks to get used to having the devices. And then we started sending them these short surveys. They were like 5-10 minutes long. And every 2 weeks we would send them. And just to get really an understanding about what they were feeling about the technology, what challenges they might have been facing, what benefits they were seeing. And we also asked about time savings and otherwise. So as you can see from the date span on this slide, COVID happened in the middle of it, so we did have a pause, but in all, we did 7 rounds of this survey between October 2019 and July 2020. We had 478 surveys, 429 unique participants from the 18 localities we're specifically working with in the QIC project. Vast majority of those who responded, 70%, indicated that they were actually using technology, while we also, again, over time, we're looking at what some of the answers were pre and post-COVID. We'll go less into that today, but we did have more than half of our surveys received came from post-COVID era. So what did we learn? Who uses Compass Mobile? So we wanted to find out perspectives of the users versus the non-users. And what we found were that users were more likely to have more encouragement from their supervisors about using it. They had a larger caseload. They also were likely to use the other technological support offered that we've been studying, which are the transcription services. They reported lower levels of concern about the technology, about using it with families. They expressed higher levels of gratefulness about receiving the app and were more likely to endorse the ideas that Compass Mobile would save them documentation time, whether it came from just documenting contacts, intakes, investigations, and otherwise. And they also believed more strongly that it would provide them with support in the work that they needed to do. So really this, if you flip it, it looks like, again, when those who had more encouragement, had more need, were really more tech oriented. They were also using transcription services, and those who were more comfortable with technology were more likely to use it. When we talk about the impact of Compass Mobile, we asked we just asked the users about the impact of it. And as you can see, vast majority, or the majority, over 50%, indicated that it was providing support for the work they needed to do. It reduced the time it took for them to enter documentation. It enabled them to respond in a more efficient manner to the needs of children and families on their caseload. It also, between 40 to 50%, indicated it had freed time so they could devote to other tasks, increase the accuracy of their participant demographic information, and freed their time so they could engage service providers in case planning and more time with face-to-face with children and families. A smaller portion indicated that this time they could use to engage better with a wider circle of formal or informal family supports. And about a third-ish indicated that it had enabled them to do more quality coaching from their supervisor, which largely is because the supervisors could oversee some of the work that they were doing through a portal that was made available to supervisors. We also looked at the pre and post impact of Compass Mobile on workers. We asked them to self-report about the impact. And here we're just looking at the answers that we got pre-COVID, because as we all know, COVID threw a whole wrench and changed a lot of dynamics in work. But from the 105 surveys that we got before COVID hit, we found that on average, after Compass Mobile was introduced, we saw reductions of an hour, or reports of reductions of at least an hour on average for documentation time and commuting to the office to enter documentation. We also saw reports of reductions commuting just for supervision and consulting with their supervisor, some reduction in consulting with peers as well. But there was no difference in the visiting, the time that they were spending visiting with families, at least from those 105 users that reported. So we also asked them more specifically, because of course this is a big concern, about Compass Mobile and family engagement and what their perspectives were. This figure really breaks down the sort of distribution of the answers. The purples are answers are those where people indicated that they were not at all, or more negative or neutral on whether or not it had their responses to these items, while those responses in green are more positive and range from somewhat to very much. So as you can see, we really had a large group of people that indicated they were at least somewhat to very satisfied with Compass Mobile. That's like 84%, I think we calculated. While 62% of the respondents indicated that it had at least somewhat reduced their stress, being able to complete work in real time. And similarly, about 62% agreed that at least somewhat that families seemed comfortable with their use of Compass Mobile. But in contrast, 23% indicated of the respondents indicated that Compass Mobile had at least somewhat hindered family engagement. But on the other hand, close to half of the respondents indicated that Compass Mobile had at least somewhat to very much supported them in increasing family engagement. So that's an area to delve in and dig more in the future. And we also saw that Compass Mobile was associated with a positive response on average about engaging, helping them engage their families better. So we asked them about satisfaction with Compass Mobile. We did open-ended questions, and the themes that emerged from there was that generally, again, it was just being able to access that information, whether it was case information, case contacts, historical case contact information, entering information, the efficiency and accuracy that staff were feeling was associated with having this device with them and getting work done in real time. It really provided a good support to be able to complete the work remotely. There are features such as reminders that are very helpful for staff to remember. It's time to get that assessment completed and submitted. And then as a nod to what happened during COVID, the state was able to roll out across the whole state a DoxyMe virtual meeting app, which was HIPAA and high-tech compliant and able to facilitate face-to-face virtual visits with children and families, even when in-person visits were not an option. So our next steps is that, again, we have a lot of data. We're going to be linking the baseline and follow-up surveys. We're going to be linking human resources data and the usage data about mobile tech to really understand the characteristics and attitudes and perspectives of those staff who use it versus those who don't. We also want to understand more about the patterns of use. When are they using it? How are they using it? What aspects of it are they using more? And we ultimately, again, the whole purpose is to look at whether or not usage has an association with turnover or even just time to turnover. So we're excited. We feel like this tech use data is going to offer some additional insights that we don't often get about casework, because we're going to have idea and insights into the type of contacts, the way it's being used, and also some insights really about how certain cases might be more challenging, require more intensive work. So we get some insights about case acuity, workload, workforce dynamics, and child welfare outcomes. So we're very excited about the work that's to come with this effort. I have to do my disclaimer that when Anita and I present, this is funded by the grant, and that the content of this doesn't reflect the views of the federal government, but it reflects the research that has been funded. For further information about the QuickWD, we have a myriad of ways to follow us. I would suggest starting at the quickwd.org webpage, and then from there you can learn more about the project. So thanks very much.
Thanks so much, Dana. That was really, really helpful. With that, we're going to track our panelists and hear more about clients and the impact of mobility on clients. But before we do that, I'm going to ask you folks to tell us a little bit about what your favorite features in mobility are. Travis, maybe I'll start with you.
Favorite? Well, that's going to be a tricky one. I would say probably the forms. I primarily did, we called it ongoing, we're changing to call it in-home, the in-between of after an investigation happened, providing services to a family. So every time you want to talk to someone that is a relative or that or to connect with a new service provider or to get records from the schools or any of those situations, obviously, you have to get a release signed. And so to be able to just go into the app and actually be able to go to the participant and then go to the forms, and it pre-populates their name, their address, their date of birth, their social security number, and all I have to do is type in like who I want to be able to talk to and what their information is, and then have them sign it there, and then either be able to email them a copy if I want, like them being our participant, or being able to email it to the provider with an email saying, and it's an encrypted email, saying, you know, met with so-and-so today, can I get a copy of the record sent to this fax number or this email address? And away we go. And so it made that aspect of my job where I used to have to be like, oh no, let me dig in my bag. Let me find this form. Oh, I don't have the right form because this one's for substance abuse. Let me go back to the office and get that form and either have me or someone else come out and have you sign it when they're back out and all gone. Just here you go, sign right here. Thanks, have a great day.
Perfect, perfect. It sounds like it's made a difference, Travis. Anybody else want to share anything about their favorite features?
You know, what I can tell you, Cheryl, is I had this family who had a kid who was hospitalized. And so they were discharged from the hospital, and I was able to use the camera to capture the medicine for this client. That was important to make sure that there was a continuity of medical treatment. And that made a big difference for me to help a family, but support them in the whole process and connect them to the right mental health, psychiatries, and all the supports that the family needed. It was awesome. And the camera feature actually has been used as a sort of like a scan mechanism that I can take a picture of documents, and then you have those documents, and you know, I don't have to, again, like my colleague said, and Travis, like I don't have to go back to the office. Like, you know, I have all the tools at hand. I have my cell phone, I have my iPad, and I'm able to support the family better, even in a home visit. So it makes a difference to have the tools to be able to do your job, and actually to be able to do your job in a more creative way that allow for engagement to happen. If we have time, a quick story. You know, I helped during the pandemic, right? And by the way, you know, I didn't lose a beat, if you will, with the use of mobility. You know, the mobility allowed for continuity, really, for us to do our job and to do it well. And so I was able to use the iPad. A client needed to register the child in school, but everything is mobile. And so we used the technology to do the registration during a home visit and completed that registration. And not only that, but we were able to upload the documents right then and then so that the school would have it. And so they have all the information ready. And this actually, the child, it was someone presented with autism. And actually I was able to connect nonverbal child. I used the iPad, the technology, to engage with that child. She was drawn to the iPad and started drawing in my iPad. I'm like, yes, we connected. So it made a difference. So I couldn't be happier, but I'm sure my colleagues have more stories and features that they want to share.
Those are hard to beat, Carlos. That's pretty awesome. Connecting with a young person that way is incredible. So wonderful. Brett, I know that there's some thoughts that you have about kind of your favorite features and working with the application.
Yeah, absolutely, Cheryl. You guys know the saying, when I grow up, I want to be like so-and-so. When Case Connect in Alberta grows up, I want it to be like Compass Mobile. I hear these really cool features it has, and I'm like, man, I'm so excited and can't wait to see what rolls out next for us in the use of mobility here in Alberta. I think one of my favorite features that we already have is, of course, the ability to do up graphs. Before, you wouldn't have done up notes until you had time to do the whole note because you couldn't save it in our old system unless it was complete. So being able to do all those jot notes and stuff now, and then just taking a couple of minutes in the end to finesse it and enter it is brilliant. So thank you so much for that feature. I think that would be my absolute favorite one. I also think the ability to upload some of our signs of safety tools is great, because you're trying to find a way to capture it in a note, and sometimes it just doesn't capture how much work and the impact and the things we've gotten in those meetings without having the ability to upload the actual tool itself. So that's a wonderful feature we have as well. Thanks.
Perfect, Beth. Thank you. Megan, I'm going to ask you this question. What was one of the most important lessons that you learned in through the implementation? And then we're going to turn to our clients. That's the most important part.
I guess personally, I would have to say patience, because I was very excited about Compass coming out. The very first time that I heard about it, I was like, yes, and I want it now. So I was very impatient because it just sounded very wonderful being able to do all those things out in the field. And like my colleagues have talked about, at the beginning, there were certain features that were added on as we had access to Compass longer. So for example, we didn't have forms right away. We couldn't do things like safety plans right away. And that was stuff that I was very eager to have in the beginning, because like my colleagues were saying, it's been very helpful to be able to access forms in the field. And for example, this morning I was meeting with a client, and the lady has quite a few mental health diagnoses. And we were talking about getting her set back up with a counselor, because she's not currently on any medications and is not in counseling. And I said, would you like me to make a referral for you, or would you like to do this yourself and I'll follow up later? She said, nope, I want you to do it, because if you don't, I'm not going to follow through with it. So I was able to have her sign a consent so I could retrieve some old information from prior services and get her set back up. So I would patience, because I love it, and it has been a wonderful asset to our jobs as a worker and our clients.
Great. Great. Well, thank you for that, Megan. So now let's shift to talk a little bit about the children and families that we serve. So what was the biggest impact on the work that you do with clients? Megan, do you want to start?
Sure, that's fine. Sorry, I think I started talking before it was off mute, but as far as the biggest, I'm sorry, can you repeat the question? I heard what you said.
Sure, yeah. So what was the biggest impact to the clients? So you were all excited about it and learned patience. And then you got working with families. And the first time you pulled out that iPad, what was kind of the reaction, or what was your experience in working with them?
So far, I have had great experiences with all of my clients. I haven't really had any clients that have been uncomfortable with it. I think, like some of my colleagues were saying, the use of technology in the home does make them more comfortable, because they're able to see what we're doing when we're out there, and we can go over information with them. So I think that has been a good impact on them, being able to access information. We can go over assessments with them. We can have them sign the service plans as we write them. And then that way they know what we are working on with them, and they're not left in the dark, so to speak. Because I think when we were doing paper copies of service plans and assessments, we would come back to the office and type those up, and we'd either have to take them back out to the field and have them sign and then mail them a copy of it. So being able to go over it with them, and then we can email it right from the iPad. So I think there's been a lot of great impact on the clients.
Great. How about you, Brian? What's been your experience?
I was a little afraid to use it at the very beginning, because I thought it was going to be a distraction. But I thought the benefits of using it was just going to outweigh it. So I just went ahead for it. And, when I pulled it out, it was natural. It was just a normal part of the conversation. And they're like, I shared, rather than taking notes, I use this to type so I can have more of a better conversation with you, and that I don't have to go back and type up the notes, and I can stay here longer. We can talk through it all. I usually ask the kids for permission. Is it okay for me to type it up? I've never had any of the children, no matter what age, or any adults say I can't use it. So it's been very just normal now. Everyone doesn't have an issue with me typing. And I can keep the eye contact since I'm a good typer. It's just more of a good conversation.
Good, good. That's a good perspective. I wonder about any times when people have not been receptive. Brett, have you ever had that experience where people aren't receptive to you using mobility while you're working with them?
Yeah, I don't run into it very often because, like a lot of the colleagues have already said, technology is something we all use. Everybody has a hand, everybody has a hand, of course. Everyone has a phone attached to their hand, like even young kids, right? And so I think a lot of people are actually more comfortable than when we'd walk in before with a clipboard and paper and pen. So I think it takes some of that off of the table. However, I have run into it a couple times where they haven't said it, but you can see just with their body language that they're a little nervous. And I see it sometimes more so with people with mental health concerns, right? Like, what are you doing over there? What's saying? So sometimes it's just as simple, have a conversation like, hey, I'm just taking some notes over here. I like to tell people I'm old and forgetful. So if I don't make jot notes, I'm not going to remember, the very important things we talked about. And so I think sometimes that puts them at ease. And when that doesn't, I also let them know that they have the ability to see if they want to. So if they're wondering what I'm writing about, they're more than welcome to take a peek around, or we could do them. I mean, not so much with COVID now because we have to be 6 feet apart and maintain distances. But I think it's just putting people at ease about what we're doing. And if it isn't working, I have no problem closing my laptop, focusing on the conversation and doing that odd note later on. So I haven't seen it be a huge barrier.
Good. Good. So we talked a little bit about children, and I know on the mobility, and I know with Alberta Signs of Safety and other folks, that ability to draw. And Carlos, you talked about this great experience with this little person who had autism. Other kinds of experiences where it's good for people to kind of show their own journey.
Yeah, I don't mind sharing a little. I guess I have two different versions. One where if they're I don't want to sound ageist. I've had older clients that are like, why do you need that? And I just kind of make a joke, like, there's an app for everything now. And they're like, oh, yeah, there is. And that can usually smooth it over a little bit. And I also inform them, like, I type faster than I write. So this is going to go a lot smoother and faster for you if I don't have to say, can you repeat that again? Can you repeat that again? So I make sure I get the dates down, or the social security number, or whatever it is that I'm trying to write. And usually one of the two will smooth it over really quickly. And if not, obviously do whatever works best for them and pull out that pad and go out to your car and type it all up real quick when you're done.
Great. Good. So you said you had two. Is there another experience that you wanted to share with us, or is that?
It was either the joke about there's an app for everything, or
good,
justifying or explaining how it'll go faster and if I don't have to have them repeat themselves over and over again.
Well, and that handwriting is sometimes an issue. The decipher this is a challenge for sure. I think my handwriting degraded when I was a caseworker greatly from when I started to when I finished. I'm not sure it's gotten much better, but I'm not sure it's gone the other way. But mobility certainly makes a difference around that. Any other barriers that people experience? So what about times some of you go out to do child protection investigations? That's part of the work. Not always the easiest part of the work. So are there times in those situations where it's not appropriate to be using a mobile device? What are your thoughts, folks?
Could I speak on this for a second?
Sure.
So I don't do child protective services, but I do family preservation, and part of that is responding to urgent situations or when we're on call after hours. And there are certain situations that it just doesn't feel right to go straight in and open up your iPad and start with that. So what I try to do in those kinds of situations is handle the things that need to be taken care of first, the immediate needs. And then as I continue to talk with the families and clients, I would pull out the iPad and go from there, because there are certain times where it just doesn't feel appropriate to sit down and open up your iPad. Like if you're talking, sometimes about serious abuse or neglect, it's hard, and you want to make sure that the clients know that they are you're listening to them. So I think in those situations, I would either, jot some notes down with my pen, and then I'll go back and type those up later, or just pull it out when the timing feels more appropriate after we've handled some of the deeper or more emergent needs.
That's a good point, Megan. I think that's probably a good approach. Others, Brian, you had some thoughts?
Yeah, so I mean, there's a feature on the iPad that if you don't want to type, you can just record. So if, like I said, I've never had a situation where a client was not comfortable with me typing because they felt it was more accurate typing in the moment than going back to your office and having to type it up later. But, if I ever did run into a situation where they weren't comfortable with me typing or using the iPad right there, I would just ask if I could record them. And that's a very nice feature that Compass has. So.
Great. Brett, you had a perspective as well.
Yeah, absolutely. I think Megan touched a little bit on it. There's some times where it wouldn't be appropriate to take it in, such as when we're doing like forensic interviews, sometimes like that, right? And so I think in those moments, we would do some jot notes, maybe on a paper and a pen to jog our memory later on. Or if we're going out after hours with police, there's some crazy situations we can get into where I wouldn't be bringing my laptop along. It would be go in, get out, and then do some of the things later on. So there are some times where there isn't the use for it. However, it's we're doing that documentation later on, probably not in the office, especially if it's after hours. So then having that ability to still do that at your home later on is definitely helpful for whoever might be responding later on.
Good. So lots of you do on-call in the various different areas that you work in. So you're working evenings and weekends and unexpected situations. What's been the impact of having the mobile app available? How has that helped? So Brett, you touched a little bit on, afterwards you might be able to write some notes at home, but are there other ways that this has been a helpful tool to you around that?
Yeah, I can touch base on that. So with the new app, we're able to do those drafts, but we're able to do those drafts on files that don't exist in our system yet. And so when we aren't even able to put a file up on the system, we can't put a note on there or anything. So before this, it was always on paper, hidden in a desk somewhere, waiting for that to be opened up by an intake worker or somebody when the weekend or on-call shift was over. So by doing this, we can put it on the app, type it out, save it as a draft, and then we can actually go into that draft later once the file in our system is opened and connect it to that file, and then it automatically uploads for us. So it creates just a lot more consistency with emergent situations.
Great. Is anybody comfortable sharing a story about kind of one of their experiences on call and kind of dealing with some of those things? So that's a great tool. Luke, any families we can think about that you've gone through something similar?
Cheryl, I don't mind sharing. I actually, during COVID, at the very beginning of COVID last year, did a whole investigation for 40 days, only online. I still have yet to ever meet this family in person. And so having the ability to do things remotely and on the system meant that for 40 days, every contact, every face-to-face, every safety plan, everything I did with the network was all done remotely. So having the ability to capture those things, not only when we're directly with people or directly in the office, is super essential in the work that we do for sure. I did it for 40 straight days with one whole family. I mean, we do it with people all of the time, but that's one scenario that stands out to me where I never personally stepped foot in the same place as a mom and her child at that time.
Okay, thank you. Any other stories folks want to share about that?
Yeah, sure. I was thinking about, during the pandemic, and do you recall when families were food insecure and then they didn't have an opportunity to go to the store? So I was able to engage with my families during that time. I would wear my N95 mask. We would meet outside at a safe distance. And I was able to help them, engage them. We brought them groceries. The kids were no longer hungry. And so the technology made it possible that, again, I took the pictures of the intake papers because we need a signed agreement. I don't do protective work, but I do more of the prevention work. So my services are sort of voluntary. If they want to engage with me, if they want the support, I'm here for them. I'm here for the families to help their children, and to meet a need, and that made it possible. So just like Brad said, you have to adapt and you have to just get creative. And how do we keep serving families? Because I think this is where they need us the most. And during this pandemic, it proved to be true. We were able to serve, families with no problems. But I wonder what would it be like if we didn't have the mobility and the technology. So thank you for all you do.
Well, thank you for all you do. That makes a big difference, and a big difference to the kids and families that you're working with. And you're right, Carlos, during the beginning of this, when food insecurity was a significant issue for folks, just being able to have an extra tool in your tool belt that could make that more efficient as we help families is really important for sure. Brian, you had a perspective that you wanted to share.
Yeah, I just wanted to share, having access to the structured decision-making tool that helps us CPS protective service workers determine whether a family is safe or conditionally safe or unsafe, and whether or not we have to implement a safety plan in the field. That other help with the SDM tool, the structured decision-making tool, only helps us be more accurate and thorough in the field in determining when a safety plan is needed, even if we just met the family after hours and it's not going to be our case, or we have no previous history with the family. It helps us ask those questions and determine the true needs of the family and if the children are at risk.
Good. That's helpful. Just a helpful perspective of kind of getting through all of that for sure, and helping the family with that, and your own thinking as well, giving you some time to do that. So I've heard there's lots of contact notes and use of mobility that goes on in your car afterwards. And I know Virginia has a feature that allows notes to be read to them when you're safely parked at the side of the road. So can you tell us a little bit about kind of that work, not necessarily that feature, but the work that you end up doing afterwards, after you see a family? So you're in and you kind of do some notes, and then you're moving on to your next appointment. Is there some opportunity? Does mobility help facilitate any efficiency that way?
I don't mind speaking of that briefly. I remember I was leaving one home visit, and I got in my car and I was like, okay, who am I going to see next? And then I was like, I don't remember what my last conversation with them was. I don't remember like anything about what my visit was with them last month, because we have to see them every month. And so I looked it up in Compass, and I was like, oh, because I was out that week and a coworker saw them for me. And so I hit to what you were speaking to, I hit the button to have it read it to me. And so while I'm driving to that visit, it's reading to me what happened at that visit, what the conversation was. And so I'm just that much more able to speak to it when I get there and be able to know what all the pointers are I need to address again when I arrive there. And so that definitely, one, saved me in that moment of not being like, so what was talked about last month? I don't even remember seeing you, and filled me in on all of it because it was all right there at my fingertips. But also made sure that I, on their end, could not waste their time with that entire visit.
Great, good. Well, it sounds like a helpful tool for sure. So I know that we have a question in the chat, so I'm going to read the question, and then I'm going to ask a couple of folks to respond to this. So Andrew, thank you very much for your question. You're wondering whether Virginia of Alberta or Alberta maintains two systems, the mobile app and the desktop or paper system. And if so, how have you managed different workflows and different capabilities of the two? So maybe we'll get Travis to first speak to kind of Virginia's situation, and then ask Brett to speak to Alberta's situation, and then I can add on a couple of things. But Travis, go ahead.
Yeah, so in Virginia, we have the mobile app on our iPads, and then we have a web-based platform that gives you full access to everything on the mobile app. And we have our legacy system, Oasis is what it's called, that has everything else in it. And I guess the best way to say it is when we designed Compass, it was to give workers things they can do in the field to improve their field work. So not everything in our legacy system goes to Compass. All of the client data does, all of the case contacts do, and then we've been able to add things to be able to increase family engagement, like the service plans go there, so they're able to get those signed. They're able to type up their assessment summaries for the end of their investigations so that they can do that while they're in their field, because sometimes you're waiting in court, need to be able to do that or something along those lines. Getting the forms signed are in there, but it also allows us to have that, and all the data goes back and forth to each other, except for pictures, forms, and recordings, because Oasis is an older system, and so it can't go there. But supervisors are able to access the portal and see all those things there. And so our case record has technically 2 areas. So all the data goes straight to Oasis for us to be able to run the reports for federal reports and things of that nature. But any images or media like things would go into the Compass portal and be saved there.
Great. Thanks, Travis. Brett, do you want to talk a little bit about what happens in Alberta?
Yeah, you bet. Thanks, Cheryl. So we're quite similar to Travis. We have 2 systems that do connect with each other as well. So we do all of our documentation through the mobile app, Case Connect, which then puts it onto our CCO system as well. So our CCO is all of our families, our people. We upload our assessments onto there, those kind of things. But our documentation is all done through our mobility app and then goes on there. Although it didn't eliminate one whole system for us, it did eliminate doing paper. So we are trying to get out of the way of doing a paper file as well, that everything will be online. So then it wouldn't matter if you're coming in from, where Luke's office is up in Grand Prairie or mine, we would all have access to the exact same information in real time. So anybody can access it in our province.
Great. Thanks very much, Brett. So hopefully that answered your question, Andrew. Thank you for that. That was really, really helpful. We talked a little bit about COVID, and it unfortunately has been a reality of our world. And I think Carlos spoke really eloquently about his experience around helping a family with food security issues and some of those kinds of things as they started. But really, as we started working remotely, how did mobility support you during that time? So I know, Brett, you talked about this experience with this investigation that you had to do that was 40 days of online. Anything else that you'd like to say about the impact of mobility on your experience working with during COVID?
Yeah, definitely. Hot topic there for sure. Yeah, so COVID has obviously impacted everybody worldwide and everybody's had their own unique experiences to it. I can speak to my area a little bit. Brooks, where we're from, has a meatpacking plant here. So if you haven't heard about it, that's usually how you do hear about it. And so when COVID hit very early on, it actually shut our town down completely. You couldn't go to a drive-through for months. You couldn't really leave your house. We were really impacted for quite a few months. So we did not have the ability to come into our office, I want to say, for probably a good 3 months before we were approved to come back, with restrictions in place, so we could do that safely. So had we not had the ability to use mobility to enter our things during that time, there would be a lengthy period where no notes were getting on the system. Nobody else would know where we were at in our files in our absence if I had to be off and I didn't have my documentation there in real time. So absolutely, COVID could have been a real barrier to a lot of the families we serve and work with every day had we not had the ability to enter those things during that time. So it couldn't have come at a better time for us, for sure.
Good. Thanks, Brett. Megan, a perspective in your work around that?
Yes, I agree with a lot of things that Brett said, but to build off of that, I would say that in some ways it forced people to get used to technology. And I mean that in a good way, because they really didn't have any other choice. And that, I would say that was both for workers and clients. We had a lot of meetings virtually. We were still able to keep up with documentation, like Brett said, and everybody still be able to see that, even though we were all working from home. And at our agency here in Henry Martinsville, there were some workers that were in the building, but everyone else had to telework. And we are just now starting to transition back into the office, and that's not everybody yet. So we still have a lot of people teleworking. And I would say that client participation in meetings pertaining to their family and children has increased significantly. And same with workers being able to use technology more and get more comfortable and familiar with it. I think there's been a lot of good things that we were somewhat forced to do, because most people probably wouldn't have done that if they didn't have to. So I hope that people continue using technology and we have the option to be more flexible because we do have the mobility.
Great. Thanks, Megan. So we're coming close to the end. So I just would encourage if anybody has any questions to put them in the chat. I think you might be able to raise your hand, but please put any questions you have in the chat so we can get to them all. We had a really good discussion today, and I appreciate the perspective of the folks from QICWT and sharing the information with us about the study. And of course, all of our panelists who've just did a really good job sharing what their experience is like. So if you had one word to kind of sum up, and I'm just putting people on the spot now, one word to sum up what their experience has been, why don't we start with you, Megan?
I would say wonderful.
Great, thank you. Thanks. Brian, you?
Game changer. I know that's two, but it's a game changer.
Okay, we'll hyphenate it. It's all right.
Thanks. Yeah.
Thank you. Travis, your experience?
Easy, like it just made everything easy.
Great, great. Luke, for you?
I would have to say more. More, please.
Good, good. How about you, Brett?
Sorry, could you repeat the question?
One word to sum up your experience.
Oh, brilliant.
Nice, good. Carlos?
I would have to say J for innovation.
Perfect, perfect, good. And Dana, I'll ask you and Anita as well, your one word to kind of sum up what your experience has been so far.
I'd say exciting. I think I see so much that has gone into this and how the way it's supporting staff. We haven't even talked about how there's guidance on the mobile technology, so that if there's policy or practice references they need. I mean, there's so much and so much potential for it down the line. So
great, great. Anita, anything else you'd add?
I feel optimistic for the future of child welfare, that these kinds of tools are coming online and agencies are starting to purchase them and supply their staff with the kinds of supports they need to do a great job with families. Great,
great. So we had a couple of questions in the panel, or from panelists as well. So I'm going to try to get to one of them, and one of them I might punt, but let's start with the first one. So have any of you noticed a shift in workers enjoying their work more? Travis, why don't you start with that? Oh, sorry, Brett, you were jumping in. Go ahead.
Sorry, I wasn't sure if you had said my name or not.
That's okay. Now I've said your name. You've got it.
Okay, perfect. Yeah, absolutely. I think for sure it's a time saver for staff, right? And so we're better able to juggle our job, which helps with retention for sure when we're not feeling overwhelmed by all of the tasks, because we do have not only a hard job to do, but we have a lot of tasks to do. So being able to juggle those, I think, helps keep staff around for sure.
Good. Travis, how about you?
Yeah, I know we had some staff that would talk about how it could be almost rejuvenating, even if they were resistant at first, to learn some of the things, because it made it easier for them to do their jobs, and it made it better, like work-life balance, not have to stay late to do things, because it just put that much ease on their work.
Great. Great. So I do know that there's one other question from Lee about the Alberta panelists and some of the differences between some of their systems and features that they have in Case Connect. And I also know that folks in the province are giving some consideration to this. And so Lee, I'm going to take your question offline and get back to you with who you can chat with about that, who will really give you some good information. But I think one of the things that we've learned speaking for the panelists and their amazing content that they've shared here today is really that although we're on opposite sides of the border in terms of in Canada and in the US, social work practice is fairly similar, and the experiences that people have are pretty similar. And so it's been wonderful that these folks have been able to share this. I think they've developed some relationships and will be colleagues across the border and be able to share some ideas, which is fantastic as well. So thank you all very much for joining us today. My apologies, Lee, for not giving you a more fulsome answer on this question, but we definitely will make sure that you get that information. Great. And with that, I'm going to turn it back to the APHSA folks. Thank you.
During the break, be sure to stop by the exhibits and sponsor section of the platform to visit with Accenture, Benti, CITI, Google Cloud, IBM Watson Health, Mathematica, Northwoods, Optum, and Redmane to learn how their solutions can assist your agency in delivering quality programs and services to your community. And the more you visit, the more chances you receive for the gift card drawing from APHSA.